Good morning, and welcome to this edition of AARP's Facebook Live. My name is Maren Turner, and I'm the State Director for AARP Kansas.
Thank you.
At AARP, we believe that people should have choices in the way they grow older. Unfortunately, there are stereotypes and myths that get in the way of people having those choices. Here in Kansas, we're looking at how health disparities, a lifetime of exposure to health disparities, can impact the choices
Mhm.
that people have as they grow older. We're working very closely with our partners, the Kansas Health Institute, the Wyandotte County Area Agency on Aging, and the Johnson County Area Agency on Aging to combat this whole issue. Specifically, we're looking at the topic of social isolation. We're very happy to have with us today Joyce White from the Wyandotte County Area Agency on Aging and Philip Steiner, who is an analyst with the Kansas Health Institute. Welcome to both of you.
Good morning. Thank you.
Morning. Thank you for having me.
Why don't we just get started and talk a little bit about, what are we talking about when we say that people are isolated or socially isolated? Philip, can you just talk a little bit about that?
Sure. Yeah. So the idea of social isolation is defined as having few good quality social contacts or infrequent social contacts. So folks who don't have a lot of opportunity to talk to or spend time with close friends and family. This is also sometimes thought of as something like loneliness, which is a little bit more subjective. It's the feeling of being isolated or alone. But both, loneliness and social isolation can have a negative impact on health. And I should say too that these are both pretty common in the United States. Before the pandemic, it was about 1 in 5 adults. Estimates varied, but some put it at about 1 in 5. And it's gotten worse since the pandemic. So I think a recent survey by AARP and the United Health Group showed that it's about 2 in 3 adults have experienced either isolation or loneliness.
So that's pretty serious when you think about adults. And I've read somewhere where social isolation can be just as devastating on your health as obesity or as smoking.
Absolutely. It just as high of a risk of resulting in death as obesity and smoking, air pollution, physical inactivity. I think one of the ways that this affects us that I've read is that it being alone, being isolated, it increases our stress and our feelings of anxiety, and that can have a negative impact on our heart. There's data that shows an increased risk of chronic illnesses like heart disease, an increased risk of stroke, and some limited evidence that it shows it impacts our immune system, cognitive functioning. You're at a higher risk for dementia and other issues. So it's certainly a big impact on our health, and also it can impact your ability to seek care. Some folks who are isolated are more likely to be hospitalized, which can also have its own issues.
Yeah, yeah, this is a serious problem, and it's not just unique to Kansas. This is a problem that we're having across the United States. And as you mentioned, not only before the pandemic, but definitely during the pandemic where people were socially isolated. So, Joyce, can you just talk a little bit about your experience? You've talked about the fact that you've experienced some social isolation and it has impacted your health in some ways. Can you just talk a little bit about your experiences? What does that look like?
Well, for one thing, being isolated, it makes you feel real lonely, very, very lonely, especially when you're used to getting out, going around, have family around you, friends and everything. But when the pandemic came along, I was lonely. Sometimes I thought I was having a panic attack. I've been in the hospital twice.
Oh.
Yes. And when my heart. It was basically, it had affected that because when you're used to having your family around you, you used to going, and then when that came up, I was stuck in the house. Leave from the front room, I walk to the back, look out the window, look out the front, and then you had your TV and your puzzles and stuff, but that's not enough. I sit there and then, sometimes I would cry because I'm just lonely. Wasn't nobody there to come and visit you, when you used to everybody coming and visit you all the time. And just sitting there is a lonely, lonely feeling. And you sit there and you say, dang, where is everybody? Why nobody come see me? Well, the kids got to the point where, they don't go out that much because of the virus that was going around. And then I got COVID back in January,
Oh.
and that kept me in the hospital for a while. And then when I came home, it just seemed I was just miserable.
Mm-hmm.
Um, I wanted to see the kids. I didn't, I got my grandkids. I couldn't see them. Um, it was just, why ain't nobody coming to see me? And then my neighbors, everybody stuck in the house. Where I live is mostly all senior citizens, and everybody was in the house. No one came out. And we used to walk around the complex there. We sit on the porch and everybody waving and saying hi. And when you don't have that no more, all you
Mm-hmm.
do is looking out the window and all you see is apartment buildings. You don't see that many cars going around the complex because people wasn't getting out. Um, and then you
Well,
get on the
Joyce,
phone and
yeah,
I
Joyce,
would call
yeah.
people.
Do you think this experience of social isolation got worse with the pandemic, or do you think it was pretty much the same?
I think it got worse.
Okay. Yeah.
Yeah. Because people still are not visiting like they used to because he's scared. They're scared to getting out, and people just don't come around. Like my grandkids, I don't see them hardly, very seldom. I don't know if they think that by my age that they catch something,
Hmm.
or they don't have time, or they're busy or whatever. It's just real lonely,
Yeah.
and they
Yeah.
can't seem to understand how lonely I am. They feel, well, I guess, grandma up there in age, so, she all right. But I want them to call me. I'm used to them coming by and I don't see them like that anymore. And it's just a lonely, lonely, you just feel like you're by yourself.
Yeah. Yeah.
You're by yourself.
Yeah.
And that's
Um,
a miserable feeling.
yeah, that's a miserable feeling, because we are people and we need people.
Right,
Uh,
right.
we conducted some research that showed that even when you're out and about, and if you see people, but you can't, um, uh, they have on masks and whatever, you can't really connect with them like you're used to. Like there's something there that's missing because you're so used to that interaction. So we definitely need people, and that's why we're working with Wyandotte County Area Agency on Aging, the Johnson County Area Agency on Aging, and also KHI to see what we can do about this problem so that people are not left alone and isolated. As we talk
Yes.
about some of the solutions, one of the things that came out in one of our conversations, particularly with KHI, is it would be really great if we could encourage healthcare professionals to include a question about social isolation during their screening. So, Joyce, when you would go to the doctor, your doctor would ask you, you know, are you socially isolated? And not just ask you if you're socially isolated, but have some resources available to you to help. How important do you think that would be?
I think that'd be real good because a lot of times, when I have went to a doctor, they're asked, do you feel as if you're suicidal? They asked me, do I feel threatened in my own home?
Mm-hmm.
My doctor asked me questions like that, but it's just, sometimes you just feel like you just by yourself, you're lonely, and it feels good uh, to get out and go somewhere. Even when I go to the grocery store, it just to look around and see people.
Mm-hmm.
You're not so lonely. And right now, you just feel depressed sometimes. Well, at least I do. Get depressed and sit there, and especially when you're so outgoing and used to doing things. And we have the center. I'm so used to going to the center every day, seeing people your own age and playing cards or puzzles or talking. And I mean, I didn't feel lonely then. I had all, people my own age.
Mm-hmm.
But when the The virus came and everybody was locked down like in the house. That was so depressing. It really was.
Wow.
And it's just now it just seemed I thought it was getting ready to kind of open up, but we've been waiting to get back to the center.
Mm-hmm.
I'm just dying to get back to the center because that way it didn't bother me if I didn't talk to the kids or anything because I had my friends there. And it was just so wonderful. And we can't wait till the center open back up.
Yeah, that hopefully it will be soon.
Hmm.
Hopefully, oh yes, go. That's 5 days a week I go, and
Uh-huh.
I went every day. I'm there every day, and it's
Yeah.
just so good to just socialize, talk. We crochet, we knit, we do the puzzles, we have bingo, we do exercise 3 days a week. I mean, it's just wonderful.
It's that social interaction.
Yeah,
So I'm
that's it.
glad
But see, you don't
that
get that when you're at home. All
you
you have is just the windows and the TV.
I'm so glad you have the Wyandotte County Area Agency on Aging that you can go to, and the staff there are super supportive. So I think
Oh
that's
yes.
Philip, when we talk about maybe creating a policy either through the legislature or, just trying to encourage doctors or healthcare professionals to screen for social isolation, particularly when older people come to visit them. What are your thoughts about that idea?
Yeah, I think there are a lot of benefits to including screening for social needs and in healthcare visits. I mean, if you think about it, we know there's a health effect of social isolation, or being isolated can negatively impact your health. And so, just addressing that might alleviate might alleviate some symptoms or some conditions that are currently being used or treated with medications. So, it could be an alternative to medications, or it could be a complement. Maybe you still need the medications, but you can get connected with other people, and that might help alleviate some of your loneliness or anxiety, and that can just improve your overall health. So I think that's a really good idea. It's also nice to just give people other options for how they go about thinking about their health and the care that they need.
Too many people don't know about organizations like the Wyandotte County Area on Aging. They don't know that that resource is available to them in their state or in their area. I mean, so I think of that as one resource, as Joyce was talking about, as a way to just get out and to, not be isolated and
Mhm.
have to know who you are and to check on you. Churches can sometimes be very helpful if they know that you're socially isolated, as can a number of different clubs that people have belonged to, be it a Rotary Club or a knitting club or whatever it is. In
Mhm.
the future on this special edition of Facebook Live, we're going to talk about how important open spaces are. So having parks and having places where people can get outside and bike and breathe in fresh
Mhm.
air and see people, encouraging people to get out on their porches and say hello to their neighbors. I think that's lost on us. We don't do that as much.
Mhm.
So we're going to be talking about a number of issues around this topic. So I want to thank you again for being here today, Joyce, and looking forward to hearing more from you next week, Philip, when you talk a little bit about health disparities. What are we talking about when we talk about health disparities? And what does a lifelong exposure to them do when it comes to not only your health, but this whole problem of social isolation? So I want to thank everybody in the audience who came out today, to thank again our guest this morning. And we look forward to seeing you all on this special edition series that will run through August. Again, next week we'll be talking about healthcare disparities. The following week we'll be talking about open spaces. And then the last week we'll be talking about caregiving and how caregivers can become isolated, or how they work with older people who have become isolated. So again,
Mhm.
thank you so much for today, and have a groovy day for the rest of the day. We look forward to seeing you later. Bye bye.
Bye bye.
Bye bye.